hair loss treatments, PRP injections, and Minoxidil. Struggling with hair loss? Here's what you need to know. Hair loss affects millions of people, but today we're exploring two powerful treatments, PRP injections and Minoxidil. Which one is right for you? Hair loss is a common concern, affecting both men and women. Whether it's due to genetics, stress, or other factors, finding an effective treatment can be overwhelming. Platelet-Rich Plasma, or PRP, is a revolutionary treatment that uses your own blood to promote hair growth. By isolating platelets, which are rich in growth factors, PRP stimulates hair follicles to regrow healthier, thicker hair. The process is simple. Blood is drawn, processed in a centrifuge to concentrate platelets, and then injected into areas of the scalp experiencing thinning or hair loss. Results can vary, but many patients see improvement after several sessions. Minoxidil, what is it? Minoxidil is a topical treatment commonly used to treat hair loss. It's available over the counter and helps stimulate hair growth by improving blood flow to the scalp and nourishing hair follicles. Minoxidil easy to use, effective for many. Minoxidil application and side effects. Minoxidil is applied twice a day directly to the scalp. It can take several months to see noticeable results, and side effects like scalp irritation may occur, but these are generally mild. Consistency is key. Combining PRP and Minoxidil. For enhanced results, many people combine PRP with Minoxidil. The combination targets hair loss from different angles, providing a more comprehensive treatment. Costs and considerations. PRP therapy can cost between $500 and $1,500 per session, with multiple sessions needed for best results. Minoxidil is more affordable, usually around $20 to $60 a month. Conclusion: is it right for you?